Hey everyone, welcome back to day 2. As promised, we're going to cover some ergonomics, which Brandon just talked about, some of the things that you want to be focusing on with your workstation. Today we're going to talk about the exercises that go along with the things you need to be aware of for ergonomics. Just like we talked about yesterday, those core stabilization muscles are incredibly important to engage during your workday. Big things we want to focus on is that tuck of the belly, those shoulder blades back and down, and your chin tucked. We're going to try to isolate all 3 of those things today with the exercises that we do and keep a major focus. As things that's going to happen throughout your day, you're going to get busy with work and you're going to be in your position for a prolonged period of time. We want you to start being a little bit more mindful about the positions you need to stay into to really keep those muscles engaged. So we're going to work on a little bit of pelvic tilting that'll go on, some shoulder blades back, and that chin in a proper position so that you can withstand your workday in that kind of position. All right, first thing we're going to do, just like last time, is we're going to start with a warm-up, okay? We're going to do the same warm-up like we did yesterday. I'm going to grab a chair, just in case of that balance issue like we talked about last time, and we're going to be marching, right? So we're bringing that knee up to about hip height, and we're going to go one side to the other side, all right? We're going to start now. Ready? 1, 1. 2, 2. Make sure you keep that belly tucked. 3, 3. Those shoulder blades back. 4, 4. 5, 5. 6, 6. 7, 7. Hold on if I need it. 8, 8. 9, 9. I like to get that arm involved in there. 10. And 10. All right, great job. I'm going to move the chair away a little bit. And we're going to start warming up our upper body just like we did yesterday, okay? Same thing, belly tucked, shoulder blades back, chin tucked. We're going to be lifting our arms straight up, bringing those hands out to the side, and then bringing them back to the chest. The things that we really want to focus on are making sure that when we lift those arms up, we feel a bit of a stretch underneath these arms, maybe a touch in our mid-back. And then as we go out to the side, we're going to feel quite a bit across our chest. Okay? Let's get started. Up, out, and back for 1. Up, out, back for 2. Up, out, back for 3. Up, out, back for 4. Up, out, 5. Excellent. Keeping that chin tucked. Really think about your chin as you're in this position here. Not making sure that it juts out and bends, but keeping it tucked so that your neck is nice and long. Great, that's 7. Up, out, feeling that stretch in your chest. That's 8. Up, out. And back for 9, last one. Keep that belly tucked. Out. And back for 10. All right. Great job. Okay, now that we have some blood pumping and we're a little bit warmed up, we're going to start focusing on those postural muscles and the things that we want to be thinking about. Obviously, with sitting all day long, it's going to place a toll on what could possibly be our low back. Things that we want to think about is where our pelvis is in space. I'm going to roll my shirt up a little bit so you can see my belt buckle. Things that everyone wants to be focusing on for postural stability is where your pelvis is in space, okay? Many people can kind of spend the majority of their day tilted forward, where they have like a bit of an arch in their back, and then others do the exact opposite, and they're kind of tucked under, where there's a spot here, some lengthening in the back. Neither of those spots are excellent to be in for prolonged periods of time. And they both come with, where your body is according to your desk. So what Brandon talked about earlier in the slideshow is really focusing on having that upright posture and a good ergonomic setup. From here, we're going to talk about the muscles that need to be engaged to maintain that neutral position. So the pelvic tuck is how we do that. We're going to work on seeing if we can keep our belt line and tuck under to an extreme position where you feel a gentle mobilization of the bottom part of your spine. And then we're going to go to the exact opposite, which is tilting over. Now, if you notice, there's not much happening with my legs. I'm not really swaying forward and swaying back with my whole body. I'm really just isolating that pelvic movement of tucking under and bringing it back out. As I arch my back, I really feel right around, just above my tailbone area, working a little bit. And then as I tuck under, I feel just underneath my belly button engaging. One helpful tip while doing this, if you have a chair or even if you do it up against a wall, some kind of stable surface will give you increased stability. So it'll help you find the muscle that you need to use to get this mobility going back and forth, okay? We're going to work on a mobilization for a 10 count, holding each position, that forward tilt and that backwards tilt, okay? So we're going to start here. Hands will hold onto the chair for that extra bit of stability. From here, I'm going to bend my knees just a little bit, almost as if you were like getting ready to play shortstop. You're going to engage your core muscles, just gently be aware of them. And from here, we're going to tuck under, and we're going to bring it back. That's one. Tuck under, bring it back. Once again, not much happening in my knees. It's all happening in my pelvis. There's 4. Don't worry if you have some mobility in your knees. It's okay to have that happen. We want to try to work and see if you can really be aware of what's going on in the pelvis as you do this and get better at it as time goes on. We're tucking under for 7 and back out for 8, 8, and then back under for 9, 1 more, and back. Great. The reason why this is so important is that so when you are sitting, you can find your neutral, which is not going to be, it's not the extreme on the front, it's not the extreme in the back, it's finding that middle ground and then using those muscles that we just engaged. Those muscles, a lot of times you're going to be aware of them just underneath your belly button and you'll feel them working a bit as you get ready to sit in your chair and stay there throughout the day. Okay? Great job. All right, now that we've done some work for our midsection, our pelvis, we want to start thinking about the next section in the chain, which is going to be our mid-back, our chest, okay? Things that we want to be thinking about is that posture we've talked about. Shoulder blades together towards your spine, so shoulders are pulled back and they're pulled down. They are not coming up, right? This is not the position we want to be in. We really want to be pulling back and down. Exercise that we're going to do is the same as the last one in the sense of we're going to go through extremes of motions, okay? We're going to use our shoulder blades and we're going to reach forward and actually round our back, taking our shoulder blades, if this is my spine, taking our shoulder blades and rounding them away from our spine, okay? I'm rounding away. And then from there, I'm going to stand further back up straight, my chin tucks, and I'm pulling those shoulder blades together again. Okay, so I'm going through the entire range of motion of my mid-back. It's a great mobilization and stability awareness exercise, right? Forward and then pulling back into that position, okay? Ensuring that your shoulder blades are back and down. All right, we're going to start with this now, okay? I'll actually stay to the side, this way you can see what I'm doing. We're going forward, reach, 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 reach. Coming back up, squeezing those shoulder blades together for 1. Same thing here, reaching forward, squeezing the shoulder blades back for 2. Forward, I feel a nice little stretch here in between my shoulder blades. Coming back for a squeeze, hold for a little bit for 3. Forward and back. 4. If you feel any strain in your neck, feel free. You can actually tuck your chin even more if you want to. And then bring that on back for 5. Forward. 6. We're just trying to get aware of the muscles that we need to use to stay in the correct posture during our day. There's 7. Forward. Pulling back for 8. Forward, back for 9, last one here, really reach forward, Pulling back, shoulder blades together and down for 10. Great job. Okay, last but not least, we need to talk about the third section of this chain, right? We've done belly, we've done mid-chest, now we're going to talk about the neck. This is the one where if you work at your workstation the most, it's going to be the most effective, especially depending upon where your monitor is fixed. A lot of people during this pandemic have had their laptops out on their dining room tables, which has been very dangerous for posture because it really promotes this type of look, which is when your head starts protracting away from your spine. Like Brandon had said, the human head weighs around 12 pounds on a 45-degree angle. That's magnified to be a ton of weight on the back of your neck. It's very unhealthy for the spine to stay in that position for a long period of time. Now, someone with MG, a lot of times you can have some difficulty throughout the day getting yourself back up to here. It's very common for that postural problem in the neck to happen. So we want to do simple exercises that focus on awareness of the correct muscles and the correct posture so that when you get pain, your body is going to find its position to get back into the correct spot, okay? Obviously, pain is an alarm system to your body. When you're feeling pain or you're feeling some numbness or tingling, something like that, you want to get yourself back into these positions. Don't just stay there and think about how your neck is bothering you. You've got to do something about it, okay? And that's what we're going to talk about now. The chin tuck is very, very important and very subtle, okay? Obviously, this is the position that many people are into, right? My ear is a bit in front of my shoulder. When I pull those shoulder blades back, if I don't do anything with my neck, it gets even worse, okay? Now what I want to be doing is I want to find a way to get that chin back. The exercise that we're going to do now, all that I'm looking to do is I imagine there's a string on the top of my head, like as if I'm a puppet, okay? And it's like someone is taking that string and pulling it taut to make my head tip into this direction. The start of a nod, and I'm engaging my deep neck flexor muscles, which are right underneath my chin area here. What ends up happening as I do this, I feel some engagement underneath here, and I feel an elongation throughout this section. It's kind of nice because I'm bald. You can see that when I'm here, this section underneath the base of your skull gets really tight and aggravated. When you tuck that chin, that space gets opened up, and that frees a lot of the musculature in your neck to work the way they really should. Most of your neck musculature really starts right around this upper part of your back and then links up behind your ear into that section of the top of your head, okay? The chin tuck that we're going to be doing is we're going to be using your hand to give you a little bit of an assist, a gentle, not even really a push, just a reminder. Push into this area, I'm pushing back to my neck, and I'm engaging these muscles. And that will be 1, okay? Pushing back, 2. Pushing back, 3. Try not to move your chin. The exercise isn't it's just here for 4, okay? Try to pay attention to the back of my head if you're confused by it. 5, 6, 7, 8, 9, last one for 10. 10. Like I said, these exercises are meant to work on a little bit of mobilization and some awareness on what muscles you need to use to be safe in your work environment and to keep your posture secure. Now that we've gone through all 3 mobility and stability exercises, let's try to link them together, right? That pelvic tilt, we went forward, we went backwards, let's find the middle, okay? I'm engaged in the middle and I can feel the muscle that helped me move it is now just subtly, very, very, just barely engaged. From there, I'm now going to pull my shoulder blades. We're going forward, back, and I'm going to find that middle ground where they're just a little bit engaged. Same thing here. We've done protraction, now retraction, and we're going to hold here. That's our posture. That's the position that we want to get into. When you are feeling fatigue hit you as the day goes on, or you're feeling pain, or you're feeling tightness, I want you to rely on that postural knowledge that you now have. When you're here falling down, gravity's taking its toll. Try to just get a reset, maybe get up, take a walk around, come back, reset yourself up into that proper position to make sure that you are safe while you're working. All right, great job. We're going to end now with a restorative exercise. Like we talked about before, the musculature around the neck mostly really attaches this upper part of the spine, the outside edge of the shoulder here, and comes up throughout the neck and then inserts behind the ear and then the base of the skull. We now want to try to take care of that musculature. As very often, one side might be very tight or both sides can be tight throughout the day from holding this head up in this position going forward. What we're going to focus on is that same posture as always, and then from there, we're going to tilt. We'll start with our right ear. You're going to bring your right ear towards your right shoulder, and that would give you a stretch on your left side. There's ways to advance this exercise. If right here, if you feel a good enough stretch right in this section of your neck, that's totally fine. Keep it there. Don't worry about advancing it. If you want to go further with the stretch, you can take that left hand and you can reach it behind your back to the small of your back on the opposite side. Okay? From there, when I depress my shoulder down a bit, that's going to increase this stretch, right? Because this muscle starts here and ends here. Well, now I'm opening up this area. Okay? That would be first advancement. The last and final way would be I would take my right hand and I would kind of just put it on the outside of, like just above my left ear, and I would be pushing down gently, very, very gently, just increasing that move there, okay? We're gonna now do this. We're probably gonna do about 5 repetitions of this, holding for around 5 seconds. We're also going to move our head just a touch. When we get into these positions, we're going to actually look down a bit and then look back up for a couple of them. This way we're just mobilizing the muscles around this area, and we're hitting a few different muscles at once, okay? Like always, belly tucked, shoulder blades back, chin tucked. We're gently going to bring that right ear to the right shoulder. I'm now going to bring just this left hand back. I'm going to leave the right hand alone. And I'm going to let gravity do some work for 1, 2, 3, 4, 5. I'm going to come back to neutral. Coming back again. Hands behind. I'm going to bring right ear to right shoulder. This time, I'm going to actually start looking down towards the floor. This has changed that stretch behind the ear. 1, 2, 3, 5. Come back to where we came from, which was looking forward but head tilted to the side, and then come back to neutral. We're going to do one last one. That hand comes behind my back. I'm going to bend my right ear to my right shoulder. From here, I'm going to use my hand this time. I'm going to look down first. I feel that stretch. I'm being very gentle with everything that I do. Now from here, I'm actually going to come back to that neutral position of looking forward. And then lastly, I'm going to look up, very, very little. You don't have the same range of motion looking up as you do down, but you'll still feel how that changes the stretch a bit. I come back to neutral, bring it back up, okay? Let's do our other side. Everything's the same, okay? That right hand this time is going to come to the small of my back. I'm going to bring my left ear to my left shoulder, get that stretch on that left side, and I'm just going to look forward. For me, I'm a little bit tighter on this side. I'm going to give myself a little bit of extra pressure, very, very gently. And we're coming back to neutral, okay? We're going to do that again. This time we're going to look down as we do it, okay? Right hand behind, left ear to left shoulder. I'm going to add the hand for me this time, looking down towards the floor, giving that extra bit of pull. Very gently, back to neutral, hand down, and head back up to neutral. One last time, we're going to do the down and then also looking up, okay? Left ear to left shoulder, right hand comes on behind. This time I'm not going to use the hand. Engage a little bit of a stretch looking forward. Now I'm going to look down for a few seconds. And now I'm going to turn and start looking up. Gently come back to neutral and head back upright. Once again, this is a restorative exercise, especially at the end of the day or even the middle of the day if you need a break and your neck is starting to feel tight. A great one to get a bit of pain relief and improve some mobility in the neck. Okay? Great job.